Well, it's the end of the month again. You know what that means? Not to pay bills. It's question and answer time. You send the questions, and I'm going to do my best to answer them in this episode of Healthcare Hacks. Hi, my name's John. I'm your healthcare hacker, and I'm fully vaccinated against COVID. I hope you are too. If you're not, please do your part and get vaccinated. Before I get started today, I hope you take a minute and follow us on your favorite social media platform. Here at Athos Health, we're trying to get our message out about how to navigate the complex U.S. healthcare system. That's what's important to us. And by following us, you help feed the algorithm and you get as many eyes as possible on our message. It helps us get it out there. So as I mentioned, this episode is all about questions and answers. We have 2 questions from our membership this month related to videos from earlier in the month. So let's start with a question from Katie from Portland, Oregon. Katie asks, I heard you mention Blue Cross Blue Shield and how their denials can lead to larger patient responsibility. Huh? Yeah, Katie, this is a complex question, and I'm going to try to keep it simple because I could literally talk about this for an hour and nobody, and I mean, even my own mother doesn't want to hear that. But Blue Cross Blue Shield is not like other health plans. Specifically, it's a conglomeration of 30 plus health plans that are kind of state by state generally, where Blue Cross Blue Shield Minnesota is a separate organization or separate company than Blue Cross Blue Shield of New York. So to operate as a big nationwide health plan, they formed the Blue Cross Blue Shield Association. I know this is boring, but stick with me for just one more second. This association allows people in New York that have Blue Cross Blue Shield Minnesota to still see a provider, still have a network, etc., where Blue Cross Blue Shield Minnesota doesn't have to have network contracts with all the providers in the country. It seems like a great idea, but there's a problem, and it has to do with denials. So typically, if a member gets denied for medical necessity, so something was done where the provider did a procedure that was considered investigational, unless the member signed something, the provider is responsible, right? So if I, here in Minnesota, have Blue Cross Blue Shield in Minnesota, and I go to have my knee replaced, and something screwed up on the bill and it's considered not medically necessary, I won't be responsible. The provider will, and they'll have to appeal that denial and try to fix it. Here's the catch though. If you're out of state, so let's take that same example. I'm getting my knee replaced, but I'm in New York, and the same thing happens, it's denied for medical necessity. Well, in that case, unfortunately, I'll be responsible. It's how the association works. If you're out of state, out of your home plan, so in my case, out of Minnesota, and something's denied, I'm going to be financially responsible. It's crazy, even though I go to a network provider. It's the only health plan I know of that works that way. Now, the reason I bring this up and mention as part of our broker and consultant video series is, if you're helping employers make that choice, something to consider, especially if they have a lot of employees out of state, so out of the home state. Employees could be at risk for large financial costs because of how Blue Cross Blue Shield works. The other big plans, Aetna, Cigna, United Healthcare, etc., don't work that way, and you won't see that problem. You might see other problems, but you won't see this problem. So be really careful and make sure you ask those questions of Blue Cross, and make sure if you do have a lot of employees in other states, you might want to consider recommending a different plan. The second question comes from Bruce from Eagan, Minnesota. Bruce asked, what's the craziest thing you've seen excluded in a summary plan description document? That's a great question, Bruce. I had to think about that one for quite a while. There's been some pretty crazy things I've seen. But the one that really kind of blows my mind is venipunctures. Drawing blood, right? That's simply what it's for, lab tests. I ran across one health plan where in their summary plan description document for that employer, they said, we will not cover venipunctures. The member is going to be fully responsible for them. Now, these are not $10,000 procedures. These are $30, $25, really small dollars. But the member is going to have to pay it, and they have to pay out of pocket. It doesn't go through their benefits. I saw a situation where a member went in for their annual physical. They had some blood work done, their cholesterol checked, diabetes checked, which would be covered. The lab tests were covered, 100% preventative. The member didn't have to pay anything out of pocket. But because the venipuncture wasn't covered, and you need to draw blood to get blood to do the lab test, the member had to pay $30. I mean, it's crazy. It was the silliest plan I've ever seen. Not a big dollar, but again, if you see something like that, and that's why I say pay attention to those exclusions, because that's where it was in the summary plan description document. That is the best way to anger an employee base, is something silly like venipunctures being excluded from the plan will make them more upset than anything else. Only 2 questions this month, so it's relatively short. But if you have any questions, comments about these topics or any other, please leave them in the comments below. We'd love to hear from you, and we'll try to address them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me next episode of Healthcare Hacks.